Welcome to the Alignment with Jenn podcast. I am your host, Jenn, and today we have a very special guest, my good friend and an exceptionally well-trained doctor, Dr. Key. You may also hear me call him Dr. Peter or Peter. Dr. Key is a triple board certified doctor in internal medicine, rheumatology, as well as integrative medicine, also osteopathic medicine, as well as traditional Chinese medicine. So we have a verifiable expert on our hands here today. And I'm really looking forward to having this conversation with you, especially because, we have been friends for a while. And so I know you in a friend sense, but I'm excited to get to hear more about your experience working with your patients and your medical training, and also how you blend that with your spiritual practices. Because we also call you the modality collector, meaning you go to more events, you do more learning and personal growth than most people that I know. There's some competitors, but you might be taking the cake. So I'm excited to get to hear all that. So welcome. Thank you for being here today.
Thank you so much for having me. I have been following your work as well, and then it has been inspirational in my own growth as well. So thank you.
Oh, that means a lot. Thanks. I'd love to start off kind of hearing about you and your past and really what led you to where you are now.
Okay. Sounds good. So as you can see, sometimes I keep my eyes closed to connect with my higher self. So at this point, you guys already know I'm crazy. So let's go. So I was a chronic pain patient for myself for 15 years, and I struggled. I saw a lot of different doctors, including Olympic level orthopedic surgeons, acupuncture, you name it. I tried a lot of different medicine, and then I got into rheumatology to fix myself, but I couldn't fix myself with all these drugs and injections, but and acupuncture. And eventually, after finishing rheumatology fellowship, I got into this integrative medicine fellowship at University of Arizona, founded by Dr. Andrew Weil. And then it showed some glimpse of, potential possibility. Then my path led into acupuncture training, and I went to Dr. Joe Dispenza's retreat. We went some of that together.
Yeah, that's where we met.
In Cancun, and something happened in my body. Something clicked. And since then, that was like 3-4 years ago. And then I kept doing my meditation and also yoga like every single day. And I got better. I didn't feel pain anymore. I was like, wow, this is so cool. So I'm fortunate that I have the best teachers in the world, to be honest with you. Tony Robbins, Dr. Joe Dispenza, and many other teachers. And I learned from best. They gave me some system of healing, necessary components of healing. And then I use the same thing for my healing. And then I've been giving that to my clients, and they're getting better too. So yeah, it has been an exciting journey for me and my clients. We've been growing together.
Amazing.
Thank you.
So I know that you have been really, really well schooled in the traditional healthcare system, right? You've learned a lot of Western medicine, and you're also an exceptionally spiritual person, and you seek out so many other modalities that are not typically part of Western medicine. So I'm curious to hear what led you to start seeking out those modalities and how that's benefited you and your patients.
Basically, traditional Chinese medicine taught me that there's right time for everything. There's no absolute good, or there's no absolute evil either. I think there's good in Western medicine and good in integrative medicine as well. We gotta use it together. So in Western medicine, typically we tend to treat the symptoms. For example, if you have anxiety, sleep issues, migraine, pain, joint pain, and IBD, chest palpitation, you use different medications for each thing. For example, some of you get 7 different medicines from 6 different specialists, right?
Yeah.
But the thing is, a lot of times, I'm not saying all, that most of these issues have one underlying cause, which is chronic stress, chronic fight or flight. In traditional Chinese medicine, they teach that emotional and spiritual trauma stuck on the body causes diseases. Rather than treating individual symptoms of one underlying cause with all this different medicine, I was thinking perhaps we should approach it a little bit differently because probably some of the audiences here are taking a bunch of medicine and then seeing many different specialists and maybe are still suffering. Maybe that's why they follow you, they follow me. Sometimes when things are not working, rather than trying different medicine, sometimes it's helpful to look at from the big picture, like bird eye view, look at the forest. Underlying all the chronic issues, Chinese medicine teaches that there might be emotional trauma that happened that you were holding on. So that part, is there any medicine for emotional spiritual trauma? No, that's why I became a modality collector. If you're going through a life crisis, for example, divorce, if that's happening the most pleasant way, and people come in to my office saying, "Hey, I'm stressed because of all these things, and I'm having a flare." Then not all of you can start learning how to meditate and start doing it, right? So that's what I'm doing. Basically, I'm trying to find something that can normalize your shocked nervous system back to normal to get through. And then eventually I put people in physical alignment, nutritional alignment, and emotional alignment to balance the whole thing. Because challenge will keep coming. That's the nature of this game of life. Yeah.
So I'd love to talk about each of those pillars. And I kind of want to recap. Basically, you're saying that all of these different diseases, whatever they might be, if they're psychological illnesses, right, mental illnesses, physical illnesses, the root of all of them is the stress response and the person's response to stress, essentially.
Yes.
Okay. So with that, tell me about each of these different pillars. So let's start with the physical alignment. What do you mean by physical alignment?
I simplified it. I said emotional and spiritual trauma is a root cause of diseases. That's the Chinese medicine perspective. But in modern society, we have lifestyle factors as well. For example, sitting. So if you sit for 8 hours a day, a lot of times people come to my office like hunched over and then they ask me, "Hey doc, I have neck pain. I don't know what's going on." You know what I mean? So sometimes if you look at other people, it's obvious. So sitting is like a sport. If you sit so long, body, the psoas muscle, it's designed to lift your leg up so that you can walk. However, if you sit for so long, the psoas muscle gets stuck on the shortened position. It start pulling on the low back. That's one. And then while you're doing computer, shoulders roll forward and then neck goes like that. So that's the second thing. Yeah. So there's two main things for your muscle tightness and pain, or also it can also feed into your migraine and sleep issues. One is the alignment issue from all the computers and desk job. And then also two is on top of that, stress comes. So whenever you're stressed, body feel tense. And then body tension will also exacerbate stress. So it's like a cycle. So you got to look at the two things, alignment one, physical alignment one. Basically, when people come to my office, a lot of doctors learned it in medical school, very brief time. But then I look at their foot and their whole alignment. So, there's a center of gravity. So if you look at your body from the side, your ankle, knee, hip, your shoulders and head, it should align in a direct straight line. But and also both shoulders should remain at the same height. However, when I look at it, I see a lot of asymmetry. One foot is flat, one leg is like O shape, and then always the hip height is different, and shoulder height one shoulder is an inch lower than the other side. The main thing your brain is trying to do is to keep two eyes at the same level. Doesn't care how you get there. For example, after you injure your ankle, other part of the body will try to compensate. The other ankle, knees, hips, low back, upper back, neck, and then migraine and sleep issues, and you feel tired all the time. So alignment. So basically, a lot of people. I've met two people who's very well aligned. One was a gymnast, the other one was ballerina. But most people, this is the analogy that I make for my clients. You are a car, and one tire's flat, and you keep running your car. What will happen to you? It'll break.
Yeah.
That's the physical alignment portion.
Yeah. Last year, I started going to the chiropractor really consistently.
Yeah.
And when I first went in, he's like, yeah, your head is a little bit too forward.
Yeah.
And he said that my head weighed more. Like your head technically is supposed to be what, like 8 pounds or something?
Exactly.
He said my head was like 20 pounds because it was too far forward. And he said that he's had patients who their heads have been like 35 pounds, meaning they're so far forward that the weight of gravity. So you're carrying all of that,
Yes.
right? Which is a form of stress on the body. The body's not designed for that, which I found that fascinating.
Yeah, totally.
Yeah.
Totally.
Yeah. So physical alignment is the alignment of the skeletal system. But I know what I'm super curious to talk to you about too is fascia.
Yes.
And I know that's something that you've been really excited about lately too. So is this where we talk about that, or should we?
Yeah, we can totally talk about here. So underlying cause, for example, is stress.
Mm-hmm.
And then when we get stressed, fight or flight, sympathetic nervous system gets turned on, and it messes up our breathing. So when you look at babies, when they're not crying, they're breathing through their belly.
Yeah, they're like
slowly.
soft, big old belly.
Yeah, but those adult, well-grown people who's in stress mode, they breathe shallow upper lung breathing. So the breathing gets broken down first. And then the second thing that happens is fascia gets tightened. So we have 2 million-year-old brain. So, fight or flight nervous system was designed for you to run away from, for example, T-Rex.
Yeah.
T-Rex chasing you, and then you find your secure place. You're supposed to calm down in 30 minutes. But then the thing is, in modern society, our brain cannot distinguish between real physical threat,
Right.
like T-Rex versus mean boss sitting next to you. But the mean boss sitting next to you will sit next to you for 8 hours a day.
Right.
And the fight or flight button will remain pushed.
Yeah.
And then you come home thinking about the bad incident today, and then go to bed thinking about the same person, and the button will be pressed, the same fight or flight button that T-Rex used to push.
Yes.
It's remain pushed. That's why when you're in fight or flight, all the nutrient and blood goes to fighting muscles, running muscles, right? Like shoulders and legs to get you out of that danger. But then if you're stuck in fight or flight for 24/7, all your muscles would be on guard at alert mode. And then it also shuts down non-essential function for immediate survival, like digestion. That's why a lot of ladies, you have chronic constipation, diarrhea, gut doesn't work.
Gut issues.
Yeah. So, and then all this tightness, right? When you remain in guarding mode like that, also the trapezius muscle is connected to your head as well. Your muscle, there are muscles in your head contributing to more migraine. So whenever you get stressed, chronic stress, tighten the fascia. Imagine fiber optic, like it's like internet cable in your body, and you're playing the music of fear, and things tighten. And in this fascia, for example, let's say we go to Costco together, we buy a big piece of meat for barbecue. There's a white layer they remove before you cook your steak. That's the fascia. Fascia envelop all your nerves, all your big muscles, organs, and also fascia contains nerves, blood vessels, and lymphatic channels. And when you're tight, all those things get compressed. That's why energy doesn't flow. And also your blood vessels, it compromises your lymphatic drainage as well. That's why a lot of ladies, when you're stressed, we have a fluid channel, like lymphatic. It's called lymphatic channel in our body.
Yeah.
So trash, metabolic waste from leg, arm, and head should drain here, and trash from right side also has to drain here. But when you're so tight, the shoulder area is already crowded area. So when you get stressed, fascia is tight, then trash truck in a dump, so trash start keep piling up, backing up, and then that's how immune system gets angry. Autoimmune disease. So traditional Chinese medicine model, fascia.
I think about like a lot of women are really into gua sha and like doing the lymphatic drainage on their faces and stuff to get their faces more cut, right?
Yeah.
But the real reason for that is, right, the tension that they're likely holding that's causing their faces to puff up.
Yeah, especially it happens more in ladies. 90% of autoimmune disease affecting the joints, such as lupus, Sjogren's, and also chronic pain patient, fibromyalgia patient. 90% of patients are actually women. Body keeps the score. So when emotional trauma happens, we go into some sort of guarding pattern.
Yeah.
But when the emotion is not cleared and processed properly from the body and get eliminated, if you don't do that properly, then it holds on to the guarding pattern. That's why things remain stiff. That's why the fascia remains stiff. That's why I see a lot of Vietnam veterans. Some of them, you may not talk to them, but some of them that I saw tells me that they still waking up. They still wake up choking their wife after having a nightmare. So holding on to trauma, the nervous system remembers it. So that's the part that we need to work on if we want to get better.
Yeah, it's so significant how much. And you think about like my audience, right? My audience is largely women. Women in society are technically less safe, right? Like I never get in my car and don't lock the doors or like lock the house because women are the smaller sex, right? And so do you think that that is partly what contributes to women having more autoimmune diseases? Why do you think that is?
Well, there are a lot of different hypotheses, explanations out there who thought about this issue. Why do women get more autoimmune disease or chronic pain condition? Hormonal issues, genetic issues, possibly, but I see more held emotional tension, emotional trauma. They hold on to it more. So their fascia and their breathing pattern, their nervous system hold on to the trauma more. There's a neuroscience pattern I learned from Dr. Joe Dispenza, Hebbian learning. So when nerve cells fire together, they wire together. The more you practice feeling of fear, brain will get better. So in chronic pain patient, for example, fibromyalgia patient, their brain actually go through structural changes. So it gets better at feeling pain.
Whoa.
Yeah, so there's a brain region called DMN and also insula. Those regions are in charge of pain. And also some studies suggest that the emotional center, like amygdala and memory center, hippocampus, they go through some changes too. So ladies especially, there was some previous trauma, and then due to many different reasons in society, women feel less safe compared to men, and they practice more fear each time you go to the parking lot, and then it just gets locked in. So for me, I think, people heal in loving relationship. I'm not talking about romantic relationship, but what I'm talking about is, for example, going to yoga and breathe in sync, moving in sync. You build an energetic connection with other people and teaching your nervous system body, hey, maybe it's safe.
Yeah,
that part.
You enter that coherent field, like what we enter when we go to Dr. Joe retreats, things like that.
Yeah.
Okay, so that was our first pillar. We've kind of touched a little on the second pillars, but the first one was physical alignment. The second one you said was
nutritional alignment. So nutrition-wise, not everybody's body is designed the same. Like Tony taught us, complexity is enemy of execution, right?
Yes.
So whether you look at anti-inflammatory diet, Mediterranean diet, or DASH diet, those healthy so-called diets, those things have one thing in common. They're all plant-rich diet. So I know some ladies have a heavy menstrual cycle and everything like that, but then mainly the American College of Rheumatology, it now has a integrative treatment guideline. So there's this publication from 2023 recommending Mediterranean diet. So basically, what I recommend my patient to do initially while they're going through all this flare from inflammation through autoimmune disease is that imagine a circle, like basically it represents your plate for your meals.
Okay.
I tell them 70% vegetable.
Okay.
And also healthy, so 70% vegetable and 15% is protein. Some studies from Scandinavian regions states that for rheumatoid arthritis patient, healthy fatty fish like sardine, mackerel, salmon most common, yeah. Those things are beneficial. And also less of red meat that can be also helpful. And also the starch, for example, if you rice, I live in Hawaii, so we cannot exclude rice. So those are 15%. So main meal is vegetable and drinking 60 to 80 ounces of water, because like nowadays people drink a lot of energy drink or venti side coffee and tea for hydration. Those are not the good source of hydration. You got to drink water, and removing all the refined sugar like soda, bottled orange juice. Those also have 22 grams of added sugar if you read their label, and then removing ultra processed food. So basically, they are tying together the spiritualness as well. There are food high in clean energy, for example, vegetable also helps our body. So quality food, you're merging with that energy. So that's what I see. That's the second pillar of health, nutritional health.
So, okay, second pillar. And then our third pillar is emotional alignment. Is that what you call it? Okay.
Yes.
So we talked a little bit about that, but tell me more about what that looks like for someone. Like, is it how they're responding to situations, their practices, kind of all of it?
This is the one area why I'm a modality collector. Some people have some time in their life. For example, some of my patients are retired, so they have some time. So they have time to learn about meditation and go through other type of mindfulness learning. But the main thing is this: why do we have stress? Tony Robbins says, "Life happens for us versus life happens to us." Yeah. Life challenge will happen. The reason why we feel stress is we give different meanings depending on individuals. Even for twins, we did quite a bit of studies on identical twins on autoimmune disease like lupus. If one child has lupus, autoimmune disease, the risk of the chance of the other twin having lupus is less than 30%. Because kids, even though they look the same, have same genetic material, the way they perceive stressful situation and the way they give meaning is different because their personality is different.
Yeah.
So being able to give different meaning and also catching yourself from being reactive and launching that fight or flight response every time exact same situation happens. So if you react the same way with stress at work environment every single day, that's not the game. Dr. Joe Dispenza teaches that the most important thing is having a different thought in the exact same situation. So I try to teach that. I didn't have the perfect childhood, but in spiritual healing, such as Kabbalah, they teach that it's not that our parents caused us trauma. It's not that. Perhaps my soul had detachment issue. Perhaps that's why I got parents who aren't really available. So my soul and the Creator chose my exact parents because they were the best people to reveal that situation so that I can look into, hey, where's this smudge dirt on my mirror, right? So I think about it this way. They are basically paid actors. I wanted them to play that exact role.
Yeah.
So I got it. And then the main thing is whenever stressful situation happen with certain people over and over, rather than blaming what's wrong with them, asking why are they in my movie, that might be a better way.
Yeah.
Because if you learn the lesson, for example, my parents were born shortly after Korean War, so they weren't loved the way they're meant to.
Yeah.
So I think the meaning of my mom, the meaning of my the purpose of my existence in my mom, I think, is to show her what love is. So after learning that, I started telling her, I love you. Before a couple of years ago, before you introduced me to Kabbalah, I like telling I love you to my mom. It was like I felt like jumping off the cliff sometimes. But now we do it every day. So
Wow.
every time you choose love, when you can choose love and hate, negativity, fear, you go to a different dimension. And every time you do that, you collect more light in this vessel, spiritual vessel. And then the more light you collect, the better dimension you go into, where there are more health, wealth, and better relationships. So
yes.
Yeah, I know I'm 39 years old. A lot of my clients are older, but when they are going through really tough medical issues like cancer, they ask me some guidance. So that's why I learn. I mean, my body, I didn't know that I could feel this way again, but then I do. But at the same time, I asked myself, when I was 25, I asked, like, my main question was, I'm 25. Why am I in this pain all the time? Now, I think God or Creator made me sick to learn all these things to help more people. So, that's the meaning that I gave, different meaning of my 15-year-old pain issues. So if stress causes chronic illnesses, what causes stress? That's the meaning that you give to different life events. So that's the work that you're doing, giving different meaning, looking at the deeper meaning. That's the spirituality. I think spirituality is a very big component of any kind of healing.
Yeah, I so agree with you. And I think there's, in any moment, believing that there's something good, like this is happening for me in every single moment, right? This morning I woke up to this text message from somebody I dated a few years ago. And I was like, wow, I really didn't want this person back in my life, right? And they were kind of wanting to open up a conversation. And I just was like, I need to pause before I respond to this, right? Kabbalah teaches pause, what a pleasure.
Yes.
Because in that moment of pause is when you get to decide, do you want to reveal light, or do you want to react and have to rework through this issue?
You don't want to fortify the fear response in your brain. You want to undo it, right?
Yeah, exactly.
Unwire that fear pattern.
Yes,
yeah,
exactly.
Awesome.
Exactly. And so it's in those moments is who we are is shaped and
conscious
who we want to become.
Choice.
Yes,
You're
conscious
choosing
choice.
Who you want to be.
Yeah. And I like thinking of it. Did you ever play Mario Kart as a kid?
Yeah, of course.
Okay. You know when they're like driving around and they're picking up coins and all that sort of stuff and they're making the turns in the cars. I always think about it like that. I'm like, I have the opportunity to make a turn here or pick up a coin, or I have an opportunity to like drive off the cliff, right?
Of course.
In the Mario Kart version, not in real life, hopefully. But, that's the choice that we get to make and that is how our souls evolve. And I think what's really cool about your work is that you are helping people with all the pieces of who they are. And also, I just want to say, like, I think it's rare for anyone to care as much as you do, but also for a doctor to go to the lengths that you've gone to. Like, I know how hard you work and how much you do in order to learn so you can bring more back to your patients. Like every time I talk to you, you're like, oh yeah, I'm at this conference or I'm at this event or I'm going here next week. Like you're in San Diego this week and then you're going to coming back to San Diego later this week to learn more, and I think that's so fortunate for the people who get to work with you.
Yeah. Fortunately, I haven't said things like you're gonna be like this forever. I think no matter where you are, there's some form of healing. I also teach at medical school. I'm a professor at medical school. What I teach
so much.
I know I don't get paid, but what's the point of complaining about healthcare system if I have power and energy to influence others, but if I don't, then I don't want to be just one person to complain. So I'm doing what I can. What I teach my student is that just because you don't know, don't tell people you're going to be the way you are. Because Western medicine It's basically a pharmacologically focused regimen. Lab, you get medicine, and then you get routine lab to make sure that the drug is not hurting you. That model mainly. And of course, there are other disciplines as well. However, for chronic illnesses, there are quite a bit of limitation. So yeah, we had amazing teachers like Tony. I have high expectation myself. I have high expectation for you. You have high expectation for me. Mm-hmm. That's why we're friends. Mm-hmm. And also, I have high expectation for my client's life. I don't want them to feel 20% better. I want them to feel 90% better, 100% better. That's why it's. I don't do it for any other reason. Just I think it's aligned with my life purpose, revealing more, helping other people reveal more light in their life. That's why, I keep bringing things up. Your body, nervous system may not want to eat clean. You're not familiar if you're not familiar with it. Mm-hmm. But sometimes you need someone to hold your hand to make that jump. Mm-hmm. I tell them, hey, I'm Gandalf, you're Frodo. Whether you run the ring to the mountain or the other direction, I love you. I help you the right thing. I tell them, jump. Just one more. That's how I build things up. I fix people's diet first. And then alignment-wise, I send people to a lot of acupuncture, physical therapy. And then I put everybody over 70 years old on Tai Chi classes. Anybody younger, there are different options. But we do need alignment in all three aspects: physical alignment, nutritional alignment, emotional alignment, to have a amazing kick-ass life.
Yeah.
Yeah.
Yeah. Well, thank you for sharing your formula, your method with us.
I learned from Dr. Joe, by the way.
The three alignments?
Yeah.
Oh, cool. Very cool.
Yeah, Tony uses that too. So they must have known something, huh?
Yeah, I think they know a lot.
Yeah.
For our listeners, if you could leave them with like one golden nugget that you're like, if you could just do this, you would feel so much better, or your life would be so much better, what would that thing be?
Just knowing that you're not broken. And I've been following Jenn's work. Keep listening to her work. Following, she didn't pay me for doing anything, nothing like that. But rewiring your nervous system through learning how to intervene, pause, and choose different higher options for your connected to your higher soul. That's the path. You may not feel comfortable going to the gym right now, but sometimes what you need is just out of your comfort zone, and you go there, stay there, make that your comfort zone. And there's more nuggets out there, more health, more love, more loving relationships. So it's hard to learn and heal in isolation. You have an awesome community. You have built an awesome community. Yeah, people learn in loving community. I hope you continue. That's the one message that I want to give it to you.
Thank you for that. And if people want to learn more from you, you have an amazing YouTube channel that I am like, this kind of information is stuff people pay a lot of money for. So can you share how people could connect with you?
Yes. So I have my own YouTube channel called Healing with Dr. Key. It just reached 5,000 subscribers yesterday. So yay.
Congratulations.
So, yeah, thank you. So a lot of my videos are geared for Sjogren's syndrome. Sjogren's syndrome is an autoimmune disease where there's not much medical therapy, but fundamentally chronic stress is a foundation for all the different issues associated with it, like migraine, back pain, neck pain, and IBD issues. The irritable bowel syndrome issues, not IBD. And chest palpitation, patch evaluation, those things. So yeah, if you are interested in how your shocked nervous system can contribute to chronic illnesses, my channel is a way to communicate with me.
Yeah. And I listen to your videos, and I don't have Sjogren's. I didn't know what it was before, and I find them really valuable. I've been sending them to all my family members. So thank you for creating that content for us.
Yeah.
And thank you for being here today.
Thank you. Thank you so much for having me.